Hello, thank you for joining us today. We are really glad you're here. Here's Jim, your host of Time Out with Jim. So let's get started.
Since it's 1:42 in the a.m., it's going to be talking about what is COPD. Well, today, well, for the last few weeks, this is what happens when you have COPD. You cough and you cough and you cough. Keeps you up at night. Okay. What is COPD? COPD is an abbreviation for chronic obstructive pulmonary disease. It's a long-term lung condition that makes it hard for you to breathe. Types of COPD. COPD is the umbrella term when used when you have one or more of these conditions. Emphysema. This results from damage to your lung. The air sacs that destroy the walls inside them. It causes them to merge into one giant air sac. It can't absorb oxygen as well, so you get less oxygen in your blood. Damaged air sacs can make your lungs stretch out and lose their springiness. Air gets trapped in your lungs and you can't breathe it out, so you feel short of breath. 2. Chronic bronchitis. If you have coughing, shortness of breath, and mucus that lingers at least 3 months for 2 years in a row, you have chronic bronchitis. Hair-like fibers called cilia line your bronchial tubes and help move mucus out. When you have a chronic bronchitis, you lose your cilia. This makes it hard to get rid of mucus, which makes you cough more, which creates more mucus. Refractory asthma. This type may also be called non-reversible. It doesn't respond to normal asthma. COPD causes and risk factors. Long-term exposure to things that irritate your lungs is the most common cause in the U.S. That's cigarette, pipe, and other types of tobacco smoke. If you hang around other smokers and breathe in a lot of secondhand smoke, that can play a role too. Your odds also go up if you smoke and have asthma. If you smoke and have COPD, it tends to get worse faster. You might also develop this condition if you've been exposed to things like dust, air pollution, or certain chemicals for long periods of time. Your age can make COPD more likely. It develops slowly over the years, so most people are at least 40 when symptoms began. Well, I was smoking. I started smoking when I was around 15. But full time, I probably started around 16, and I was diagnosed with COPD last year, 2019. I think it was like April, May of last year. It's rare, but your genes could put you at risk for COPD. If you lack a protein called alpha-1 antitrypsin, or AAT, you may be more likely to get it. What are the symptoms of COPD? At first, you might not have any symptoms. But as the disease gets worse, you might notice these common signs of COPD. A cough that doesn't go away, coughing up a lot of mucus, shortness of breath, especially when you're active, wheezing or squeaking when you breathe, tightness in your chest, frequent colds or flu, blue fingernails or blips, low energy, losing weight without trying in either stages, swollen ankles, feet, and legs. COPD diagnosis and tests. Your doctor will ask about your symptoms, your medical history, and whether you smoke or have been exposed to chemicals, dust, or smoke at work. They'll also do a physical exam, a breathing test. Let them know if you have any ongoing cough. The most common test is called spirometry. You breathe into a large flexible tube that's connected to a machine. It'll measure how much air your lungs can hold. It's called a lung function test, and how fast you can blow air out of them. Your doctor may order other tests to rule out other lung problems, such as asthma or heart failure, which I also have congestive heart failure, and I have a cardiac stent. The other tests might include more lung function tests, chest x-rays that can help rule out emphysema or other lung problems or heart failure, CT scan, which uses several x-rays to create a detailed picture of your lungs and can tell the doctor if you need surgery or if you have lung cancer. Atrial blood gas test, which measures how well your lungs are bringing in oxygen and taking out carbon dioxide. On this oxygen part, I am on 2 liters of oxygen at night only, when it stays on. A lot of the time, when I wake up in the morning, it's like, where's my tubing go? Well, it's either around my neck, above my head, or on the floor. And laboratory test to determine the cause of your symptoms or rule out other conditions like the genetic disorder, AAT deficiency. What are the treatments of COPD? There's no cure, so the goal of treatment is to ease your symptoms and slow the disease. Your doctor will also want to prevent or treat any complications and improve your overall quality of life. As you can tell, I'm taking a lot of pauses. That's just trying to catch my breath here. One of the best things you could do to stop COPD from getting worse is to stop smoking. Talk to your doctor about different things you can try. Medical treatment. Your plan may include bronchodilators. You inhale these medicines. They help open your airways. Corticosteroids. These drugs reduce airway inflammation. You can inhale them or take them as pills. Combination inhalers. These inhalers pair steroids with a bronchodilator. Antibiotics. Your doctor might prescribe these to fight bacterial infections. Okay, here's the word I'm not sure how to pronounce. It's ROFLOXACIN. LUMILAST. It's a medicine and it stops an enzyme called PDE4. It prevents flare-ups in people whose COPD is linked to chronic bronchitis. Flu or pneumonia vaccines. These vaccines lower your risk for illnesses. And for the last 2 or 3 years, I have gotten my flu shot. I was going to get my pneumonia vaccine when I had my flu shot this year, but I guess I was in a hurry or something, so I just got my flu shot. Pulmonary rehab. This program includes exercise, disease management, and counseling to help you stay healthy and active as possible. Oxygen therapy. You may need this to reduce shortness of breath, protect your organs, and enhance your quality of life. Now, like I said, I'm on oxygen at night, and I'm on 2 liters of oxygen. Surgery. The doctor may suggest surgery if your COPD is severe and has damaged certain parts of your lungs. If you and your doctor decide surgery is right for you, you need to commit to a healthy lifestyle. You probably also need regular checkups, blood tests, and daily medications to stay healthy. Surgery may be an option if you have COPD symptoms like emphysema or chronic bronchitis. The symptoms affect your quality of life. You have flare-ups often than in the past, and you have to go into the hospital because of COPD flares. You're not a smoker. If you smoked in the last 6 months, you may not qualify for certain surgeries. My thinking on that is they would probably want you to be quit at least a year. That way the doctors would know that you're committed to quitting. That's just my guess. So, you're willing to go through pulmonary rehab, which teaches you how to best manage your COPD, offers counseling about the emotional effects of lung surgery. Surgical treatments include the bulectomy. The bullae are large sacs of air that can form inside your lungs. If they're removed, you may be able to breathe more easily. Lung function reduction surgery. If you have emphysema in the upper lobes of your lung, the diseased tissue can make an open space in which your air can get stuck. One lung gets too large and fills up with too much air when you breathe in, called hyperinflation. LVRS takes out about a third of the diseased tissue, and it may help the healthy parts of your lungs. Endobronchial valves. It's a new way to treat hyperinflation. It is to insert a tiny one-way air valve that lets air out of the diseased lobe. Within a few hours, all the air is pushed out. To qualify for this type of surgery, you must have damage only in the area of your lung, not all over. The last thing is lung transplant. If you have advanced COPD and has so severely damaged your lung that it no longer works well, you may qualify for a transplant. This is major surgery to remove your diseased lung and replace it with a donated lung. This is thought of as a last resort for advanced COPD. Your doctor may recommend it if you have very severe COPD. My doctor has not. She is trying inhalers and nebulizer medicine, breathing treatment. Your doctor may recommend it if you have very severe COPD that's getting worse even with treatment. And you have at least one of the following. You've had to go into the hospital to get treated for hypercapnia or too much carbon dioxide in your blood from poor breathing. You have pulmonary hypertension or an enlarged heart, even though you're on oxygen therapy. You have emphysema throughout your lung. If surgery isn't a good option for you because of your overall health or another reason, other treatments can help you have a better life with advanced COPD. For example, if you don't have surgery, you may benefit from pulmonary rehab, which includes group therapy with others with advanced diseases. Complications of COPD. COPD can cause many other health problems like respiratory infections. COPD can raise your chances of getting cold, flu, pneumonia. We was living in South Carolina last year, and I had to be admitted there, and they diagnosed me with RSV, so they had to come in with the gloves, mask, the gown, everything. That was the first time I got RSV, but the other times I've been in the hospital was just a cold or it was COPD related. Okay, they make it harder for you to breathe and could cause more lung damage. The flu shot and the pneumonia vaccine can help. Heart problems. Doctors aren't sure why, but COPD can raise the risk of heart disease, including heart attack. Quitting smoking may lower the odds. Like I said earlier, I got congestive heart failure. I'm on 2 or 3 medicines for it, and I got a cardiac stent. Lung cancer. People with COPD are more likely to get lung cancer. Quitting smoking can help. High blood pressure and lung arteries. Well, I do have high blood pressure. I'm on medicine for it. So every time I take my blood pressure, it's fine. I got the hiccups. Sorry about that. COPD may raise blood pressure in the arteries that bring blood to your lungs. Your doctor will call this pulmonary hypertension. Depression. Trouble breathing can stop you from doing things you like, and living with chronic illness can lead to depression. Your doctor can help if you feel sad, helpless, or think you may be depressed. Because of COPD, before I started doing these podcasts, and I was doing woodworking, like I would make signs with a router, carve with a Dremel, I don't know, just make stuff with the tools I have, make stuff with my hand. And I also did glass engravings, but sawdust and the dust from the glass, it was just making it pretty bad for me. So around August, I believe, that was it for me. I couldn't take it no more. Living with COPD. Though there's no cure, there are things you can do to stay healthy and ease your symptoms. Try taking these steps to enhance your quality of life. If you smoke, stop. I agree 100% on that, but as we all know that smoke, it's very hard. I'm still trying to stop. The longest I lasted was 3 months. And I felt really good when I didn't smoke. But now I get to the point, I'm down to my last cigarette pack, and I'm gonna wake up, put on a patch, quit smoking. I don't know. I either have bad dreams or I wake up really scared, and that's when I light up. I'm talking to my doctors about it, so all 5 of them know. Yeah, 5 doctors. I'm fixing to have 6. I gotta go to an ENT next month. Okay, if you smoke, stop. Avoid smoke, fumes, dust, and air pollution as much as you can. Take your medications as directed. Get regular checkups, which I do with my regular doctor every 3 months. With my lung doctor, I think we're still doing them every month, once a month. Do breathing exercises. Walk or do other light exercises several times a week. I would love to do that, but I also have a bad back. What is it called? Something to do with my discs. One of my back and one of my neck is all messed up. Try controlled coughing. Lots of water. Using a humidifier to help clear your lungs. That's one thing I need to get is a humidifier. Get emotional support through counseling or a support group, which I have started that last month through a mental health center here in town. Control your flare-ups. There may be times when your symptoms get worse for days or weeks. You might notice that you're coughing more with more mucus, or you have more trouble breathing. Your doctor will call this an acute exasperation. If you don't treat it, it could lead to lung failure. Medications, like antibiotics or steroids, can help, and so can oxygen treatments. You might need to go to the hospital when you're better. Your doctor will tell you how to prevent flares. Quit smoking. Take inhaled steroids, long-acting bronchodilators, or other medications. Get the flu and pneumonia vaccines. Avoid air pollution when you can. Track your COPD diet. You can improve life with COPD by just taking part in the management of your condition. One way to help your doctor is to monitor your COPD symptoms, diet, and exercise daily. Well, I don't do that, but my insurance company has this app called Vivify, Vivify, and it tracks my blood pressure, my weight, my blood sugar, if I'm swollen anywhere, do I have a dry hacking cough, etc., etc. Did you have trouble sleeping? Keeping a daily written log may help you recognize a COPD exasperation when it begins with the log. You're more likely to notice when COPD symptoms suddenly get worse. This may allow you to seek medical treatment early when it's most effective. and might keep you from having to go to the hospital. It is also important to follow a healthy, balanced diet to prevent being overweight, which can make shortness of breath worse, or underweight, which is linked to a poorer outcome. Your doctor or nutritionist can suggest healthy food choices for you. With me, I'm a big guy, and I'm 6'4". I'm bouncing around 300 to 320. I want to get below 300 this year, hopefully. By the end of this year, hopefully. When should I call 911? Get medical help right away if any of these things happen. You have severe shortness of breath, can't walk or talk. Your heart beats very fast or has an uneven beat. Your lips or fingernails turn blue. You breathe fast and hard, even when taking medicine. I'm going to read this disclaimer one more time. Materials contained on here are for informational purposes only. We are not doctors. I am just telling you what I got. The medical ways of how I'm learning what I got. And I'm just a guy, and I was trying to keep from getting sick. So we are not professional doctors. Can give advice, diagnosis, or treatment of any kind. I am just telling my story and telling you a little bit about COPD. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because it's something you have heard on this podcast. If you think you might have a medical emergency, call your doctor or 911 immediately.
If this episode touched you in any way, please share it with your family and friends. And please consider donating whatever you can afford. Go to anchor.fm/Time Out with Jim. This will help us keep the podcast going. Thank you for listening, and until next time, God bless.